Welcome back to our channel. We provide you detailed information on medicines and drugs to help you inform your health. In today's video, we can talk about Budamate-G Inhaler. Coverage, uses, benefits, side effects, how to use and how it works. Let's get started. Manufactured by Lupin Ltd. Budamate-G Inhaler. Uses. Budamate-G Inhaler is used in the treatment of chronic obstructive pulmonary disease, also known as COPD. It helps manage breathing difficulties associated with this condition. Benefits. In chronic obstructive pulmonary disease, Budamate-G Inhaler helps make breathing easier by opening up the airways and reducing inflammation in the lungs. It also helps prevent flare-ups and relieves symptoms such as breathlessness, coughing, and wheezing. The medicine improves lung function and supports a more active lifestyle. Side effects. Like all medicines, Budamate-G Inhaler may cause some side effects in certain individuals. Common side effects include thrush, anxiety, sleep disturbance, nausea, headache, cough, muscle cramps, and palpitations. Some people may also experience increased glucose levels in the blood, increased production of urine, lung infection, dizziness, vomiting, and nasal congestion. If any side effects persist or worsen, medical advice should be sought. How to use. Before using Budamate-G Inhaler, check the label for directions. Shake the inhaler well. While breathing in through your mouth, press down on the inhaler once to release the medication and hold your breath for 10 seconds. Repeat the process for the number of puffs prescribed by your doctor. After use, rinse your mouth thoroughly with water and spit it out. How it works. Budamate-G Inhaler is a combination of 3 medicines, glycopyrrolate, formoterol, and budesonide. Glycopyrrolate is an anticholinergic that works by blocking the activity of a chemical messenger called acetylcholine. Formoterol is a bronchodilator that relaxes the muscles in the airways and widens them, making breathing easier. Budesonide is a steroid that works by blocking the production of certain chemical messengers that cause inflammation and allergies. Together, these medicines help improve breathing and reduce symptoms of COPD.